Good morning, dear students. We must start on Monday, early morning. You must working. Yeah. I think it will be a good start on your working week. And I'm sorry you wait over 20 minutes. Some problem to income in our university. I read this course of lectures in second cope of our university, and today we start online form of education and have some problem to income on our cope. All doors of university are closed, and it's some time to open this door. Okay, I see that many students connect to our translation. I think we must start and today what the topic of our lectures. I start my presentation. We continue our previous term. What ending in this time? We finish on this scenario in our previous meeting. Yeah? I traditionally ask a question about our presentation. Please type in chat if you see and everything is normal, and we start. I wait some minutes to see your answer. Okay, thank you. We start. And we finish our previous lecture on these cases, scenario. By case you see in slide, and it's pandemic situation, and it's our modern situation in medicine. You know that we start to fire with Omicron type of virus, and we see 10 hypothetic patients from doctors, and we have 6 doses of vaccine, and we think to rules how we distribute this resource in medication. And in medicine we have some problem in growth country. For example, in our country it's actual when we think about resource, because some kind of treatment very expensive, and doctor must separate this. I tell about my friend in cardiology, and he will think about this all time in this position, And in principles, what we used in this mention, you see in slide, it's respect of persons, yeah. And this situation when mother said that it's I doesn't want to took this medicine for respect of her son, it's this principle when we must think about her position and respecting her autonomy and right to self-determination. Yeah. Maximize benefits and minimizing harms. Yeah. In this approach, we must think about may benefit of the person who have this type of therapy, and doctor, it's first whom we think about this variant, yeah. And justice, yeah, or this principle of drawing straws. All persons might be right rules in this world, yeah. And you see a table with approaches in this case and principle of bioethics. Yeah, I think you have an opportunity to look our lectures in YouTube channel. Yeah, I don't know it's realized in your education or no. I think it's technical simple, and what yeah, we have little time to our credit, and this principle for principles, it's questions of our tests. Okay, we start our next part of principles and rules of bioethics, yeah. And rules of bioethics you see in slide. Today we talk about three great rules of bioethics: confidentiality, truth-telling, and informed consent. Yeah, three principles of bioethics. We talk about some cases on this principle. Yeah, and I hope in the final of our lecture we may start Hippocratic Oath term. Yeah. Okay. Confidentiality. Confidentiality is the obligation of a physician to keep a patient's health information private. Yeah. You internally feeling that it's many time realized principle, and in a case on this principle I introduce you. I think it's actual, yeah, these cases, yeah. It's historic fact. You may know that the law in USA baseline on a case study, case method, yeah. And if one situation may be this time, it will be in future, and it knowledge separated in some practice. Yeah, and you see that in 1976 in University of California. There was two students, Prosejit Poddar I hope that my performance of this name is right. Yeah, it's Indian student and Tatiana Tarasova. She was a Russian student. Yeah, they studied to work in education and university, and in one time Poddar was come to medical campus in university and said that I want to kill Tatiana. It's a lovely mixed feel by life, I think, to this woman, and the medicals transform this information to psychiatric in medical campus, and psychiatric share this information to policy, and Poddar come to prison, I don't know, and this is by 2 months, and after this he was killed Tatiana, and in court lawyers discuss this situation. Yeah. This case discussed twice, yeah, and you see in slide Tarasov first, Tarasov second, yeah, 2 times in baseline and higher level of lawyers discuss this, because we see a conflict on 2 positions. Yeah, conflict by principle of confidentiality. Yeah, the student set information by medicals, and we must realize this principle. And the parents of Tarasova stay on position to have some negatives to medicals, yeah, because we in native feeling we may think that doctors must care of patients, care of society, some work by this, and in the finale, at first and the second court said the privilege, it's a fly word, yeah, privilege ends where public peril begins, yeah, and expectation of these rules you see in this slide, yeah, it's principle of confidentiality, and there are a few exceptions on this on this principle, yeah. In you may see on laws on your countries, yeah. In our country, the level of age starting 14 years old, yeah. If a doctor tells about some problem, medicals child who is less than 14 years old, we must tell with parents, yeah. Next exceptions, it's if the patient disease can harm others, yeah, it's case of Tatiana Tarasova, yeah, and the next, if the patient's disease is caused by illegal actions, yeah, in practice of our country, if doctor see any tremor in medical point, we send this information in policy, it's practice, yeah. We search some information by the environment of this case on this tremor, yeah, for example. And in my life in some week ago, I have this contact with these exceptions of this principle. Yeah, I may tell about this in these cases. Yeah, and it was on weekend, on morning. I stay in my flat with my children, and in the door come my neighborhood, yeah, from our house, and said that her husband feels sick, and she need help, yeah, and this family have a problem with alcohol. And when I come in flat, I see a man lay on a floor, and some tremor overhead of this man. Her name is Vladimir. I see blood on the floor and a tremor of her head. Confused confused situation with stopper, да, on Russian its name. It's confused consciousness in the situation when the brain damaged. And I see this, I take medical care from this man, lay on the sofa, and call to emergency services, and describe this situation. I separate some anamnesis of situation. I was tell about some alcohol in a previous day of this situation, and this patient said about some excess of alcohol, and after this in the morning he wake up on a bed and sent conscious, and in time of observation I see confused consciousness of patient. And they come to a hospital with her wife, and 2 weeks he was a coma, and after this he was die. And these cases, this situation known by the another people on my home, yeah, and I am in this situation. I doesn't be a citizen. I was be a doctor, and I must introduce principle of confidentiality. And many people come to me and ask questions: what happens? What was happened with Volodya? What do you know? And in this situation, I must said only that Volodya have some problem with health. He stay in a hospital. It's always what I am may said in this situation. Yeah. Because you think that it's right to confidentiality, some reason it's serious when we touch with doctor, with neurologist in a house, yeah, and I understand that the problem of this is alcohol excess and symptomatic epilepsy. Yeah, in 4 course we study this situation. It's situation maybe when the brain terrible by any chemical structure, alcohol one of these, and it realized extra elective activity of a brain and consciousness turn off, and muscular tonus turn off, and patient have a problem with some tremor, yeah, and it's principle of confidentiality, yeah, and after this, why I tell about this? After this, I think I see this situation only in one optical from my previous information, yeah, in medical situation, and I doesn't think about different kind of situation. And after this policy, when examine this situation, yeah, in pathologoanatomic заключение information, they write that the reason of this it's a tremor from a head, and policies find information from another people in our house, and think that its family have problem with alcohol, yeah, and it's maybe death from another reason that medical, yeah, epilepsy, and they call me and ask many questions about what I was see. Any other people in flat, they find separate information about the wife of this person, and they think in her position maybe a reason of death it's illegal action, yeah? And in this principle I send all information on policy, yeah, because it may be, yeah, next principle, yeah, you should provide medical information and the request of the court, yeah. Okay, it's exceptions, yeah, it's my main some general guidelines, yeah, of principle of confidentiality, yeah. You see in slide we talk something of this, yeah. At first, when you start a practice in hospital, you have a chief doctor, yeah, and you may ask questions and work under direction of supervisor, yeah, in your hospital, yeah. Yeah, this discuss information only when necessary in situation when this information, confidentiality information, can be maintained, these cases, yeah, this right of this patient, yeah. Yeah, it's very actual see 3 point, yeah, because we continue to positionality our professional subject in social media. And frequently we used our cases in practice and sent some information about this, and it's potentially may be problem with principle of confidentiality, yeah? And it's only after death of this in medicine. It's frequently when we open information of on patient after death of patient, yeah. And yes, social media, be attentively, any stories in medical hospital, yeah, any cases, you may be attentively. Yeah. Yeah, next guidelines. Yeah, you may work, you must work in contact with policy in hospital center, in large hospitals, in emergency services. We have a point of policy, yeah. When we come on our hospital in Releva Street, it's emergency, large emergency hospital of trauma, cardiologic, neurosurgery, traumatic, urology, some emergency situation, surgery, yeah. We have a point of policy in this hospital, yeah. Yeah, and all problem questions you may discuss from your chief, from your colleagues, yeah, and from maybe help by lawyers. In all large hospital in our country we have a lawyer, and you may ask some questions of this, and it help us to help our to work, yeah. In our country we doctors very frequently come to court and set of your action, yeah, in this structure, yeah. Next principle of bioethics, it's truth telling, yeah, truth telling. At first it's confidentiality, and another side it's truth telling, yeah. You see that truth telling in medical ethics involves the moral duty to be honest with patients about conditions, medications, procedures, any risks, yeah, it's important risks, and this can often be unplacement, but it is generally necessary, yeah. We discuss something of this, yeah. Yeah, you read this slide, and I hope when I type this, when I prepare this slide, sorry, 1 minute. I think your population doesn't very famous this serial, yeah, but it's very popular. When I started practice, when I was be a student, yeah, it's serial Doctor House, yeah, and it's one of baseline motive on this serial. Doctor House doesn't be honest, and all what they her colleagues and he believe only in a hard fact about analysis, about some anamnesis, yeah, and her mind work only in this information, because it's a fly word when anybody lie, yeah, it's a fly word from this serial, yeah, and in practice it's realized very often in all countries, yeah, because when patient come to doctor and say they try to see these cases only in position when I am not actual in this situation, I am a victim on some disposition, yeah. In our practice, for example, it's back pain, for example. Oh, I must turn on some hard working, yeah, I must sit many times in one place, in one pose, and another, my position in this, you must think about your health, you must do any movement in your working place, yeah, and you must work some exercise, yeah, and the principle of truth telling, yeah, it's near on this position when we must think from the patients, not only from your position. You must think on patient position. Yeah. What's the main point of this principle? Yeah. I try to say about this. Yeah. To position of patient and doctor, and we must discuss in information on it true, and in third course I hope that it's realized. Yeah, we in English program we our chief delayed this course by medical psychology and in third course, yeah, but in 5 course we realized this by communication skills of a doctor. And if doctor doesn't create correct questions, they doesn't give true information on this situation, yeah, on this case, on this anamnesis, yeah. And when we it's a skill when we ask questions, when we see on the face of patients, yeah, when we ask a closed patient, yeah, not open, yeah, how do you do? When we look on patient, ask correct questions on situation, very frequently patient answer a right information on this, and it's a skill. In our cathedra we work with psychiatric postgraduate education by psychology, by psychiatric, sorry, not psychology, psychiatric. And my opinion that it's a famous professional from medicine, it's a famous from communication skills, because in psychiatric we see pathological symptoms of psyche and see this world from very different position from thinking and action, yeah, from position of psychiatric patient, yeah, and it help this doctor to verify and collect information from anamnesis, and I see in a big eye eyes when I search some information from patient. I see some problems with psyche, and we try to understand what happened. And when psychiatric come to patient and tell few minutes from him and ask the situation, it's some sexual problem from, for example, or some moral choice, or some previous trauma, psychological trauma of patient, and discuss the situation of this, yeah. In these cases, true telling, doctor see this position on a position of patient, but in our practice we must realize, yeah, this principle, yeah, true information from a disease, from a time of disease, from a reason, from a side effect, yeah. We doesn't want to tell about this, it's problem area when we describe some treatments and have side effect of this, or we hope to realize some instrumental, for example, examination of patients with some, it may be expensive, it may be painful, but we push to do this because we hope that it's give you information from disease, but not only we have this, yeah. Yeah, all I written the slide, all information from diseases, from treatment, from side effect. We must discuss with patients. Yes, principle of true telling. Yeah, from position of patient, from position of doctors. Yeah, and it's a duty of doctor to think from her person and from patient person, yeah, and write formalized questions and separate information to construct all picture of this case, yeah. Frequently a patient doesn't give all information from this, yeah. And I work with this type of questions. It's my area of working, yeah, is psychosomatic diseases, and it's very frequently this patient doesn't give all information. That not lie, but doesn't give all information from a situation, and it's a skill of doctor to think from position of patients, yeah. And for example, I may describe one cases, yeah, in my practice, yeah. When I see a psychosomatic problem with headache, it's simple situation, yeah. It's tensor type of headache. In course we learning this in neurology, and only 19% of all people have this disease in situation of stress, exam, for example, or any problem. We have a headache from a psyche activity, yeah? And we understand that it's a result of a hard work of brain. But what's the reason of this? We doesn't know, and patient doesn't tell about this. Yeah, in situation of students, I understand that it's a very hard learning. Students have some headache, some feel sick from. Little time to rest, yeah, very hard process of learning, yeah. But in this case, it's a woman, it's a middle-aged woman, and she said that she work normally, only it's good. They have no doesn't problem any problem, and I ask some questions from live of this on this patient. Yeah, I asked, do you have a child? They said no, I doesn't be married anytime. Yeah, I was live all my time with mother, but my mother was die from 5 months ago, and today I live alone, and the pandemic start in this time, yeah, it's 2020, yeah, and I understand this situation, yeah. Middle-aged woman, yeah, stay alone in her flat, yeah, all her life. He take care from her mother, and they live together. They have all time together, and today she was alone. Yeah, it's a reason of her headache. But my position, it's my position, and position of my patients, it's another position. And in this time, I doesn't have a rapport, yeah, in medical term, when position of patient, position of doctors, and we connect good connection, yeah, rapport, yeah, or compliance, yeah, another term, rapport or compliance, yeah. In this case, at first time and first contact, I doesn't have a compliance with this patient. And I feel this, but she doesn't tell about this. But after 1 month ago, she come to me at the second time and said from another problem with another disease, and another doctor said that it's a problem from her psyche, and this woman come to me at another time and said this history that I feel negatively after your visit because I said some negative information about psyche problem. I hope that I am have good psyche process in my brain, in my psyche structure. Yeah, it's example when our principle truth telling may be have side effect of negative reaction of our patients, and we must have a skills to transform this information, but it's a principle of truth at a baseline. Yeah, we must be open, we must be honest and truth telling. Yeah? Okay. The next principle of bioethics is informed consent. Yeah, informed consent. We tell about this, and after that have a break, some 10 minutes. Yeah, informed consent. Yeah, it's obligation of physicians to fully discuss treatment options with patients and get the permission to proceed. Yeah? Informed consent. All our action must be right in this document. Yeah? Patient give obligation to observation, to discuss, to examine a body, to do some examination and different type of informed consent work from some operation, some activity with our patient. Yeah, all our action must be realized on this principle. Yeah, and okay, next cases yeah. Okay, I think we have 15 time to break, yeah, and continue our lecture, not disconnect, yeah, and after that we continue. Yeah. 15 minutes break. Okay, students. Okay. I think we continue. Informed consent, and it's some cases of this. In the next part of lecture we try to work practically and discuss some elements of informed consent and try to think in case methods to this problem. Yeah. Okay, I wait some minutes to students. We may have a rest, and please, who sees that I am start, type in chat that you are ready to continue. Please type in chat anything. Типа, okay, let's start. I'm here. Yes. Oh, good. Ready. Let's go. Okay, let's continue, and some elements of informed consent shows in this slide. Yeah. Disclosure, understanding, voluntariness, competence, and consent. Yeah. And this time we must understand the hard problem area of this our duty in our practice. Yeah, and all of this point we discuss and start from disclosure of information to patients. Yeah, what we must open. Yeah. We must discuss all information about diagnosis, about treatment recommendation, yeah, about probability of success of this treatment and alternative treatment. Yeah, it's important. And it's some aspect of growth of temp of recuperation of our patient because they understand that its way is right and we start any action, yeah, when we discuss alternative treatment. Yeah, because everything patients think that if doctor said about this variant, he was very actively informed me, and what another opinion, what happened with another opinion in this situation. It's maybe another way, another position, and in this time in medicine we think this very frequently. Patient come to 1, 2, 3, 4, 5 specialists in this field, in online, in another city, in Moscow, in another country, and after that they collect all information and think of this. It's problem from our society step of growth. It's society dynamic. Yeah, we live in informed environment. Information, it's grows double on the year. We grows all information in medical field, for example, and in other fields it's the same situation, and we doesn't have opportunity to find all information what happens in country, in some local situation, in some fields, and we want to operate only information about main interesting and useful, yeah, and information about health, it's very useful information, yeah. Patients work to collect this information, and if doctors said about alternative treatment, it's a point of your karma. Yeah. We must discuss all about result, risk and benefit of each. Yeah. Anticipated recuperation. Yeah, it's important in communicative skills. In Calgary-Cambridge model, we may hear this. It's a document of communication skills of doctor in medicine, and it's skills to discuss anticipated recuperation time. On this way we must discuss this. It's because our patients want to recuperate it very frequently, and in sometimes some disease not possible. Yes, and it's informed consent. Yeah. Next point is understanding. Yeah. And we must provide good communication, and we need and we help from some visual handouts, yeah, right information, literacy. Yeah, I see a work when it's very in English correlation, yeah, very correlation near communicative skills of doctor and literacy. Yeah. Physician need to be honest, yeah, it's understanding, yeah, and skills of communication is a checkup understanding, yeah. Voluntariness, yeah. Yeah, it's one element of principle of autonomy and self-determination. Yeah. We have some powerless from a patient. Yeah, and in psychiatric, it's a very big power, because we work with mind of patient, and it's we diffused in the psyche of our patients, and we may have influence on a patient decision, but they may not be coercive. Yeah. Voluntariness or principle of autonomy. Yeah. Next point, competence. Here, it's being attentively in this. If we stay in position of competence, yeah, and we realized principle of Hippocrates, yeah, we tell on our next lecture about this. Yeah, we must grow our intelligence, our skills, our information near the growth of this international process in our field. Yeah. Yeah, some competence in decisional capacity means that the individual has the values and goals, yeah, and we help our patients to create this goal, yeah, the ability to communicate it and understanding information, yeah, it's some cultural, some language problem, for example, and the ability to reason, yeah. And next we try to think practically in case methods. We turn on another variant of working, yeah, and please read the case, read the answer, and create your variant, yeah, type in chat, and we try to discuss this situation, yeah. 1 minute to working. Okay, and I B D B D B and D variant. Yeah. Uh-huh. Oh. Okay. BD variant. BD. Okay. Please look on this situation. We work in emergency department. We stay in the emergency department. And in emergency situation, at first, in the first position, we must realize medical care. Yeah, we its case is not simple because it's we have some babysitter, but it's not parents there. We see old child, 4 years old child, and we may grow the problem. It's maybe some open, for example, open broken with bladder, yeah, and it's a very emergency situation. And in this situation, we must start our action to realize help on these people without informed consent, because it's emergency cases. D, it's a right variant of answer. Yeah, and in another situation, it's the same situation. We must start to help from our people. Yes, and in the what kind of, if, for example, if we in this situation, for example, if we have a two variant of treatment, for example, we must realize treatment to sustain the life of our patient. Yeah. And after that, we must create some variant of treatment with informed consent with parents. Yeah. At first, we must save a life of our patient. Okay, next case. Please read this and try to search right answer variant. Any problem with slide? I'm sorry, case 2. I see a message. Picture is A. Okay. Okay. I demonstrate this. I see many A, B variant. A, B variant. You are in a bioethic and it's wealthy, healthy situation about our thinking, yeah, about our right of our patients, yeah. In this case, you see a pulmonary tuberculosis, yeah, pulmonary tuberculosis. It's a dangerous disease. It's may disseminated, it's may be open form. In pulmonology, we examine this. It's a dangerous infection. In contemporary situation in medicine in all country, it's a problem. In our country, it's a problem. It's not only problem of some prisons, for example, in бомжи, I don't know in English some, как же называются люди, да, without continue place of living, without flat, who live in the street. It's a problem from intelligence, from middle class of society problem, and in these cases we have a dangers from another patients in this hospital, for example, from doctors, and the physician has a duty to inform the patient and the Department of Public Health about the diagnosis. Right answer C, yeah? Because it's a very special problem, tuberculosis. Yeah, okay. Because after that, it may be said that our relatives said that we try to treat our patient from a herb, from sunlight, and another very effective approach. Yeah, we must realize our power to helpness of these people, inform her, and stay to activity in this situation. Okay, case 2, right variant is C. Next case 3. Yeah. Please read some minutes and see. I see a right answer. Arian, yeah, it's good. Yeah. Okay. Next case. Type in chat your variant. It's main variant CCCD. Oh, sorry. D. Yes, C variant. Yeah, it's right. Yeah, it's principle of autonomy. Yeah, and if patient 55 years old man said that I want to continue my life with this problem, it's my decision, it's her decision, and we stay in this position and respect this decision of our patient. Yeah, see where it's simple case. Yeah, look on this. You may hear that the cancer of a pancreas it's dangerous problem because cancer on this place, on this organ, very frequently metastatic and disseminate in near-lung organ from a 12-перстная кишка on English, yeah, we work this some problem with metastatic in the brain, yeah, in with back pain, yeah. You may should you tell him this diagnosis or no? Yes, no, type in chat. Yes, yes, especially right answer, okay. Because it's time to create new decision, yeah, what we must do in the future, yeah. Okay, next case. Multisclerosis, yeah, MS, multisclerosis. It's problem when some muscle doesn't work, yeah, and in this situation, this patient doesn't глотать on English. Feed problem, yeah, tube feeding. We need tube feeding to realize the meals from this patient, yeah. Multisclerosis situation with damage the motor structure in the brain who realize function of construction of some muscle, yeah, from the body, yeah. And the questions, yeah, what we must do in this. Is this patient competent to decide or uncompatible? Yeah? Competent or uncompetent? And I see a classic bioetic situation. Classic bioetic situation. Yeah. To answer yes and no. What we in our practice, in our country, we doesn't push some bioetic principle in our working, and what happens in emergency, yes, in territory, it's not informed as a relative of patients. Yeah, it's some problem of this. Any disoriented situation. Yeah? In practice, we try to give a singer in right place on our document and doesn't have any problem in this. But in the right variant, if we see some brain disease, yeah, if we see this fluctuation, yeah, of consciousness, yeah, in one time patients come to conscious and said yes, after this deep in the coma, sopor, yeah, and give another answer, no, and any disoriented symptoms, and after that, after staying conscious, we must think about documentation of the of this function. Yeah, in practice, we should invite a psychiatric and documented this function. Yeah, realize the intelligence on patient conscious or no, and receive this document. Yeah. Okay. Next case is sixth case. Yeah. It's simple, I think. What we must do, yeah? What would you say? Say by wife or no? Yes, type in chat your variant of answer. Must. Yes. Some answer, yeah. Not agree with patient. Yes, no. And in this situation, yeah, principle of dangerous from another citizens, and wife is part of this, and HIV infection, yeah, it's a dangerous infection, it's a lethal infection, and in law of our country, doctor must receive this information and say about this from a wife. Yeah, it's only one right answer. Yes, we must inform the wife on this. And in our city, we have some gap from this part of medicine, yeah, and we doesn't have special hospital from HIV infect patients in another large part of city, yes, another region of country. We have a specialized center with hospital from this patient. In our city, we treat these patients in all a classic hospital of our country, and in my practice when I was working in a hospital in vascular department, we see this situation, we see this case, and in sometimes we diagnosis this at the first time. Yeah, we see some in young man. We see some problems with nerve system. We see some stigma of HIV infection. We give this analysis and see a positive answer, and we invite a specialist of HIV infection, and they have a speech with relatives, near relatives of a patient, and inform it. It's a one right answer. We must inform the wife. And the seventh case, yeah. Now, how should you handle this? Yeah. You will not tell Joe. Yes, tell. Not tell. Not tell patient. Think something. Yeah, it's adenocarcinoma of pancreas. It's dangerous disease. It's terminal situation, I think, in 62 years old man. Yeah. Adenocarcinoma, a dangerous diagnosis. What we must do in this situation? Respect the family, one variant, yeah? Let the family not ready. It will tell, not tell the patient. Yeah, we should let the family decide. I think it's one of the variant. Wait for family discussing. Yeah. I think it's in this situation we see a bioetic problem. Yeah, we have a result of analysis and must in medical must tell true principle of autonomy, principle of truth telling, yeah, in one side principle of truth telling, but in this situation we see some medical problem of this, because it's problem when one of a dangerous disease kill some psyche of patient, yeah. And we may wait some time to a family discussing, yeah. We may give this opportunity in this situation because it's one day, yeah, it's normal, and I agree with main opinion of us. We should respect the family consent, but we hope that the family concilium said that we will give this information from Joe, yeah. And what happened if it's decision that we doesn't tell what we must do in this situation? Not simple, yeah. And in principle, we may give some time to thinking, yeah. And in communicative skills, in our Calgary Cambridge model, we learn this in 5 courses. It's one of a skill when we find bad news to our patient, yeah, and it's a skills. Doctor must ask a questions from patients, from Joe. Joe, I have a bad news. Do you want to know this? Or you want to have some times to think? Or you want to have near your relatives in this situation, yeah? Or we may tell this bad news from only for you at first, yeah. And I think in these cases it's not right to open information by the brother in the whole. It's not right, yeah. Because it's a principle, the principle of confidentiality, yeah, and our patient must take this decision, yeah, not only one right answer in this situation. Okay. Next, it's a huge case, Danish decision. It's a classic case of bioethics, yeah. From not my case, yeah, Danish decision. It's a classic case. My name is Danish. Okay, look on this, yeah. Please, we introduce some information of this case, and we start to think about this case on the path, and from one time to another we collect some information on, and on this information we create one answer, and another we see another problem, yeah. In this situation we see some heart disease with life-saving medical treatments, yeah. Look on this, and we try to separate any bioethic problem, and look on this and find ethical questions in this situation, yeah. Examine this information of the fact of Danish case. Yeah. Any teenagers, yes, Danish teenagers, and he has a legal custody, her aunt, yeah, and problem with leukemia, and we need some chemotherapy, yeah, some medical information. We understand that this chemotherapy kill not only bad cells on the blood and the normal cells, yeah, and Dennis would need transfusion of another cells of blood, yeah, transfusion of blood. And parents stay on prison, yeah, from or in the hospital with addicted to drugs. And that's it. It's a situation, yeah. We see stakeholders, yeah. We see stakeholders. Dennis, yeah, our patient, his biological parents, his aunt, and doctors, yeah. And in a situation of, excuse me, where one I see one episode. No. 1 minute. Okay, one aspect, Dennis I left some slide with information from a Dennis. Yeah, Dennis doesn't want to transplantate a blood, yeah, because he has a cultural aspect of this. Yeah, it very frequently situation when we have a problem with transplantation or transplantation of blood. Yeah, and Danish stay on this position. Yeah. ILS one slide of these cases, yeah, and what we see 1, 2, 3, 4 stakeholders, yeah, and some values of this position. Yeah. From position of Dennis, you see that Dennis is being loyal to his beliefs. Yeah. And he wants to receive some medical care to a greater by himself. It's position of Dennis, yeah. But Dennis thinks that it's help doesn't include blood transplantation, yeah. It's position of our patient, yeah? Position of doctor. Yeah? Doctors want to provide services to their patients. Yeah? Principle of usefulness or benefits. Yeah? Principle of beneficiency. Yeah? But we must receive the receive information from this from the parents or aunt. Yeah, and from position of parents, they want to save a life of her son at first. Yeah, but they stay on a hospital or prison. Yeah, and doesn't create this decision. Yeah, and then his aunt. Yeah. You see that aunt supporting Dennis in her principle of autonomy, yeah, and remaining loyal in their beliefs and support him, yeah. And you see a four position in this situation, and we must want to search some principle. Yeah, on position of Dennis, principle of anatomy, respect of person. Yeah, it's understandable. In principle of doctors is beneficiency. Yeah, non-maleficence or beneficiency. Yeah, we must realize all action to influence our good treatment in this situation. Yeah. In principle of biological parents, yeah, non-maleficent beneficiency include this position, yeah, and principle of justice, yeah, yeah. Is it fair if they have no voice? Yeah, some justice issues, yeah, and principle of Danish aunt, respect for person, a principle of autonomy. Yeah? Justification. Yeah? It's methods to help us to support a position in difficult questions. Yeah? Weak justification. Yeah? Based purely on subjective opinion really on and under feeling, yeah, it's feeling, not fact, yeah, can be substantiated with fact or science, yeah, are based on a cultural bias that is not universal, yeah, cultural but not universal, yeah. In medical history, you learn of some biases in medicine. Yeah, wash a hand. It's not understandably situation, and one of medical example, yeah, the Milways. You may hear this male, yeah, the Milways create this principle by heart create to her hospital, and this was said that if we come to uh, родовая, да, in where place pilot where birth baby, we must wash a hand, yeah. It demonstrates that in cultural we have a principle, but it's not universal. Yeah, it may be cultural, but not universal, but not right. Yeah. Justification are not relevant or logically linked to the facts of the case. Yeah, it's some facts, some facts. Strong justification may include, yeah, a clearly state position, yeah, some claim relates directly to the ethical questions. Clearly state position. Yeah? In these cases, in this situation, we must invite some stakeholders. Yeah, in this case, it's psychology. Yeah, and in in USA it's practice. All hospitals have psychology. In our country, it's not diffuse practice when we have a helpness of these specialists. And I think we try to help us in this situation, yeah? Because when doctors set some information from treatment, it's maybe stronger to opinion of patients. And when psychologists said about this, it's more flexible. They have some skills of communication, some empathic emphasis skills, and it's influence the right position in this situation. Reference to important fact and science content of a case. Yeah, some fact and scientist fact. Yeah. A reference to one or more principle of bioethics or the ethical considerations. Yes, strong justification. We may push this position in this situation, yeah, because we are focused to a result of a human life, yeah. Consideration of how other people will be impacted by the decision. Yeah, it's skills of our practice. Yeah, a consideration of the strength and weakness of alternative options. Yeah, and very in our practice, when doctor doesn't have any communicative skills, we concentrate of alternative negative options in these cases. We may die, we may have problem with health if we doesn't do what I want. Yeah. Very frequently I see this position, and it's more bigger alternative decision. And very frequently when doctor push her opinion from treatment, our patient come to traditional medicine. It's name in our country, it's international term, traditional medicine. Yeah, in your country, it create this branch of medicine. Yeah, when we try to treat by herb, by any psyche effect of placebo therapy, yeah, for example. It's not bad, but if we have an alternative, more effective treatment, we try to push our opinion, and it's our duty and principle. Yeah. The rest of the story you may read. Yeah, it's cases, yeah, in our history, yeah. You read this, yeah, it's word of judge, yeah. I don't believe that Danish decision is a result of any coercion, because in teenagers, yeah, we understand that from my position, from doctor is a nerve system, yeah, we understand that all сложные, да, difficulties process on our person create on a lobe part of brain, and this structure continue to millenization until 23-25 years old. And in this situation we see a native meaner saying by Dennis. Yeah. And you see this word by judge that called this decision the most difficult on her career. Yeah, it's a difficult questions. It's a case of one disease. It's most difficult from a judge. Yeah, it's not simple answer. In our practice we have this situation. You see that before we doesn't have opportunity to treat it Dennis, and Dennis stay into a coma, and he died soon after. It took place in Children's Hospital and Regional Medical Center in Seattle, yeah, Washington. 27. It's a real case on medical practice. it's the result of this. It's a death of a young man. When we discuss and create the answer of this position by lawyers, by a judge, and by some documents and some problem from mentioned cultural, ethical, religious in this situation. You may screen this main position of this case. Yeah? It's your field to thinking after our classes. Yeah. What you should do in this situation if we may on this position, yeah, on a doctor, on a relative, yeah. You may think about this. What fact may evidence to support your position? Yeah? What fact of this? Yeah, what the 3-point here? Visual thinking on this position, individual or community? Yeah, what's the first? In individual case, we see that the principle of autonomy in community. We think about one person in our community, and it's we must help on this patient in our community. We must realize this principle, and we doesn't do this in this case. Yeah. Yeah. We think about in 4-point. We think about principle, yeah, bioetic principle. What alternative options in your position? What we may realize in this? Yeah, you may think about this on these cases. Yeah. Okay. We end our part of lecture by principle and rules of bioethics. Yeah. Principle and rules of bioethics. Yeah. And it's our next lecture. We start, I think, we fully by bioetic information today in the morning. Yeah, it's huge material to thinking, but not big information from writing. Yeah, this main principle of bioethic, it's important in finally. Yeah, non-maleficence or do not harm, beneficency, autonomy and justice, 4 main principles of bioethics, and rules 3 rules: confidentiality, truth-telling, and informed consent. Yeah, it's questions of our test. It's a main topic of main point of our topic today, and we search this in our contents, да? In our big contents. If you have some questions, you may type in chat. Thank you. I see you. Yes, okay. I see questions about these lectures, slides. Yeah, I look our group in my portal. Yeah, and we have a lecture on Tuesday. Yeah. And I sent, yes, it's for you, it's information for you, and I sent a lecture to students. It's normal, and we realized this. Yeah, okay. I think it's not simple to send lecture from 300 students. Yeah, we try to send the PDF variant of presentation in your portal, in AEOS portal. Yeah. Okay. I think we have a good start to week. We work good. Yeah, not hard, I think. Okay. Good luck, and we meet from next day and start a lecture of Hippocratic Earth. It's interesting, historic, and we find a big, big decision that we start to work in our principle in medicine from many years, and it's stay on a baseline of our practice. Yeah, Hippocratic Earth. Yeah, what a principle create and how it's realized in our modern medicine. Okay, thank you for attention.